Travelling with medicines and medical devices. Are you planning to travel with medicines and medical devices? Don't end up with an unpleasant surprise. You need to know about the rules and requirements that apply to travellers. Why do you need to be careful about travelling with medicines and medical devices? Australia has regulations about carrying medicines and medical devices for your own use in and out of the country. Taking medicines and medical devices out of Australia. Different countries have different laws about what can be taken in and out. Check that the medicine or medical device is allowed in the destination country. You can do this by consulting the country's consulate or embassy. Some medicines that are legally available in Australia are not allowed in other countries. Some medicines cannot be carried into certain countries without a permit, even though they can be legally used there. You may need to apply for customs clearance for some medicines. If your medication is illegal at your destination, ask your doctor about alternatives. Be aware that restrictions may also apply to complementary medicines. Do you want to take vitamins or supplements on your trip? In Australia, vitamin D may be available at the supermarket, only from a pharmacy, or only on prescription, depending on how large the dosage is. There may also be differences in other countries, and you need to know what applies to your medication. Talk to your doctor. If you need prescription or over-the-counter medicine while you're travelling, check what medication you need. Normally, prescriptions from Australia cannot be filled overseas. Some over-the-counter medicines may not be available elsewhere. And don't forget to mention to your doctor any complementary medicines you may be taking. Make sure you have sufficient quantity of your medication. Be aware, it is illegal to take some medicines, such as pharmaceutical benefits scheme medicines, out of Australia if they are not for your use or for the use of the person travelling with you. Carry a letter. When travelling overseas with medicines and medical devices, it is a good idea to have accompanying documentation from your doctor. If you are carrying complementary medicines, ask your doctor to include these in the letter. Where possible, it is best to take a letter and your prescription. You can find a sample letter on the Australian Government's Travel Secure website. Keep medicines and medical devices in their original packaging. Doing this whenever possible makes the products easy for customs officials to identify. Carry medicine and medical devices in your hand luggage. Medicines are exempt from the 100 ml limit on liquids, aerosols and gels. Hypodermic needles are prohibited unless it is medically necessary for you to carry them. They should be accompanied with proof that you require them and be kept in your hand luggage with the medication they will be used to administer. Bringing medicines and medical devices into Australia. Australia has some programs in place to assist you when coming into the country with medicines and medical devices. Your medicine or device may be covered by the traveller's exemption, or you may belong in a special category. If you do not fit under one of these groups, you may need an import permit. The traveller's exemption allows you to bring certain prescribed medicines and medical devices into the country without needing special permission. This includes medications that lower blood cholesterol, blood pressure, blood glucose and/or gastric acid, contraception medications, antibiotics, blood glucose monitoring devices and medications to aid sleep. Traveller's exemption requirements. The medicine or device must be for your use or for a passenger in your care. You cannot sell or supply the products to another person. Keep the product in its original packaging with dispensing labels, if possible. Carry the prescription or written authorisation showing that it is for your use or for a person in your care. Carry no more than 3 months' supply at the maximum dose. Take any remaining medicines or devices with you when you leave Australia. Comply with requests and directions from customs officers. Special categories. If you're importing substances containing animals or plants listed as endangered species, check the requirements with the Australian Government Department of the Environment. If you're importing substances containing biological material, human, animal, plant or bacteria, check the requirements with the Australian Government Department of Agriculture. For more information and website links, see the Helpful Links for Travellers page on our website. Special categories apply to athletes and members of visiting sporting teams, medications containing substances subject to import controls, and injections containing material of human or animal origin. Check the TGA website and, if necessary, apply for the correct permissions. Please visit the Helpful Links for Travellers page on the TGA website for links to other relevant organisations. A final message from the TGA. Be careful about buying medicines and medical devices overseas. Medicines and devices from overseas may not have been approved for sale in Australia. There is no guarantee they meet the same standards of quality, safety and efficacy as products approved for supply by us, the TGA. For more information about the risks involved, see our website. You can find out more by visiting www.tga.gov.au or calling 1800 020 653.